Health consequences of obesity. Obesity is a serious, chronic disease that can negatively affect the health of any number of systems in your body. People who are overweight or obese have a much greater risk of developing everything from heart disease and type 2 diabetes to bone and joint disease. The obesity epidemic. The U.S. Surgeon General has declared that overweight and obesity have reached epidemic proportions in the United States. Currently, about 35% of women and 31% of men are considered significantly overweight, and 30% of children between the ages of 6 and 19 are significantly overweight. Public health officials say the results of physical inactivity and poor diet are catching up to tobacco as a significant threat to health. What are the consequences of overweight and obesity? Obesity has a far-ranging negative effect on health. Each year obesity-related conditions cost over $150 billion and cause an estimated 300,000 premature deaths in the U.S. The health effects associated with obesity include, but are not limited to, the following. High blood pressure. Additional fat tissue in the body needs oxygen and nutrients in order to live, which requires the blood vessels to circulate more blood to the fat tissue. This increases the workload of the heart because it must pump more blood through additional blood vessels. More circulating blood also means more pressure on the artery walls. Higher pressure on the artery walls increases the blood pressure. In addition, extra weight can raise the heart rate and reduce the body's ability to transport blood through the vessels. Diabetes. Obesity is the major cause of type 2 diabetes. This type of diabetes usually begins in adulthood but is now actually occurring in children. Obesity can cause resistance to insulin, the hormone that regulates blood sugar. When obesity causes insulin resistance, the blood sugar becomes elevated. Even moderate obesity dramatically increases the risk of diabetes. Heart disease. Atherosclerosis, hardening of the arteries, is present 10 times more often in obese people compared to those who are not obese. Coronary artery disease is also more prevalent because fatty deposits build up in arteries that supply the heart. Narrowed arteries and reduced blood flow to the heart can cause chest pain, angina, or a heart attack. Blood clots can also form in narrowed arteries and cause a stroke. Joint problems, including osteoarthritis. Obesity can affect the knees and hips because of the stress placed on the joints by extra weight. Joint replacement surgery, while commonly performed on damaged joints, may not be an advisable option for an obese person because the artificial joint has a higher risk of loosening and causing further damage. Sleep apnea and respiratory problems. Sleep apnea, which causes people to stop breathing for brief periods, interrupts sleep throughout the night and causes sleepiness during the day. It also causes heavy snoring. Respiratory problems associated with obesity occur when added weight of the chest wall squeezes the lungs and causes restricted breathing. Sleep apnea is also associated with high blood pressure. Cancer. In women, being overweight contributes to an increased risk for a variety of cancers including breast, colon, gallbladder, and uterus. Men who are overweight have a higher risk of colon and prostate cancers. Metabolic syndrome. The National Cholesterol Education Program has identified metabolic syndrome as a complex risk factor for cardiovascular disease. Metabolic syndrome consists of 6 major components: abdominal obesity, elevated blood cholesterol, elevated blood pressure, insulin resistance with or without glucose intolerance, elevation of certain blood components that indicate inflammation, and elevation of certain clotting factors in the blood. In the U.S., approximately 1/3 of overweight or obese persons exhibit metabolic syndrome. Psychosocial effects. In a culture where often the ideal of physical attractiveness is to be overly thin, people who are overweight or obese frequently suffer disadvantages. Overweight and obese persons are often blamed for their condition and may be considered to be lazy or weak-willed. It is not uncommon for overweight or obese conditions to result in persons having lower incomes or having fewer or no romantic relationships. Disapproval of overweight persons expressed by some individuals may progress to bias, discrimination, and even torment. How did we get here? 30 years ago, most people led lives that kept them at a healthy weight. Kids walked to and from school every day, ran around at recess, participated in gym class, and played for hours after school before dinner. Meals were home cooked with reasonable portion sizes and there was always a vegetable on the plate. Eating fast food was rare and snacking between meals was an occasional treat. Lifestyle changes. Today, children and adults experience a very different lifestyle. Walks to and from school have been replaced by car and bus rides. Gym class and after-school sports have been cut. Afternoons are now spent with TV, video games, and the internet. Parents are busier than ever and families eat fewer home-cooked meals. Snacking between meals is now commonplace. Portion sizes have exploded. Portions are now 2 to 5 times bigger than they were in years past. Beverage portions have grown as well. In the mid-1970s, the average sugar-sweetened beverage was 13.6 ounces compared to today. Kids and adults think nothing of drinking 20 ounces of sugar-sweetened beverages at a time. Calorie intake has increased by 30%. In total, we are now eating 31% more calories than we were 40 years ago, including 56% more fats and oils and 14% more sugars and sweeteners. The average American now eats 15 more pounds of sugar a year than in 1970. The rise of screen time. 8 to 18-year-old adolescents spend an average of 7.5 hours a day using entertainment media, including TV, computers, video games, cell phones and movies, and only 1/3 of high school students get the recommended levels of physical activity. Determining your healthy weight. Weight and height are used to calculate a number called the body mass index, BMI. For most people, BMI is a good estimate of body fatness. BMI does not measure body fat directly, but research has shown that BMI correlates to direct measures of body fat and is a quick and easy guide to assessing your own body weight. However, to determine if excess weight is a health risk, a healthcare provider would need to perform further assessments. These assessments might include skinfold thickness measurements, evaluations of diet, physical activity, family history, and other appropriate health screenings. A BMI of 25 to 29.9 is considered overweight. A BMI of 30 or higher is considered obese.